Okay, I'll go a little bit more about deflection. It's a very important concept. So deflection happens due to this one very simple principle. This is the shape of our implant drill. Most implant drills, this is just a random one, they are tapered at the end, they have a pinpoint cutting edge, and on the sides here, just imagine if you're going into, for example, like we covered before, a molar socket. Molar sockets have the lamina dura and the interseptal bone, and if the pinpoint of your drill doesn't directly engage a flat spot, this section here, this non-cutting kind of flat spoon section is going to hit the edge, your pin is going to slide, and it's going to grab onto the next flat thing it finds. And it's very, very hard to feel that through the guide, even though you do develop a kind of fine motor feel for guided surgery. You sometimes don't see it happening through the equipment you're using. So to prevent that, the major thing you can do is, of course, make a round burr incision to make yourself have a purchase before starting the guided surgery. All it takes is just popping the guide on, taking a look at the bone, making sure there's no tissue in the way, making a small divot inside whatever, a molar socket or a knife edge ridge, just so this sharp edge has somewhere to engage, so that when you push down, it doesn't slide off to the side, it goes right down to where you planned it. And when it is deflecting, you'll actually feel, it feels a little weird. You're holding the drill and something is pushing your arm out. It's hard to describe, you'll feel it during surgery.
Won't stay on the teeth.
Yeah, the surgical guide starts moving a little bit.
Up and off the teeth, and you're having to really hold it down. Darn good sign you're being deflected.
Exactly, yeah. Another thing you can do is, if you're going to a longer drill and you notice yourself being deflected, start back again. Really make sure you're on the long axis of the tooth. Go down a size. For example, you're at an 8mm drill and you're getting deflected. First start with flattening, of course. There's a flat drill. If that doesn't work, go down a size. Make sure you're up and down. You're not getting swayed anywhere with the 6mm. Then go back to the 8, see if you're getting deflected. If you still are, pop the guide off and see what's in your way. Areas of cortication we covered, thin ridges. Sinus floor is a cool one. You can play around with it a little bit. There's actually, in future courses we'll go over this. Blue Sky Bio actually makes a guided sinus lift kit. It's actually very predictable to use. We've used it plenty of times. It's very nice. I don't know if anybody does interior sinus bumps here, but if you want to get a little bit more engagement past the sinus floor, if you need some more length in your implants, you can use this kit to kind of help you out with that. But also it's very corrugated, so it could cause some deflection if you're not aware of it.